please, I present Joan Rivas and the experience of people waiting for liver transplant during the COVID.
Hello, good morning. Thank you to Elpa and Teresa for inviting me and our association to this meeting. I'm a member of the Catalan Liver Transplant Association and Liver Transplant. Our association helps and informs patients with liver diseases, and more specifically with transplantation. My goal today is to give a quick review of the latest information published on transplantation in Spain during the pandemic, the consequence and results. This information is provided by the National Transplant Organization here in Spain. It's just an extract. Next, please. Well, in this first chart, we see the evolution of organs donation in Spain, a leading country in this regard. The first thing we see is a drop in donation of about 22% due to the pandemic, which means that there have been 37.4 donations per million population in 2020, compared with the 49 in 2019. Today, we know that it was 22%, but at that moment, in March, when everything stopped, it was a worrying situation because nobody knew how long it could last. Now we can see it just was 22%. Next, please. Here we see the comparison with other countries in 2019. We see that Spain continues to lead despite the pandemic. We don't have any information yet for the rest of the countries, but in spite of that, we can see Spain is still perhaps 2 or 3 times in compare with other countries. It's a 49 per million population, the figures. Next, please. Well, we have seen the donations. We are going to see the transplants. If we have fewer donations, of course, we have fewer transplants. In this case, it represents a drop of 18% in 2020. When everything was stopped, the first concern was what will happen with the transplants and the waiting lists, because nobody had information. We were in contact with the main hospitals, which were passing us a little information to inform our patients to stay positive. It was a horrible moment due to the disinformation in this time and the state of confusion in general. Any drop is a worrying situation, but in our opinion, the numbers were bad in this moment, but they could have been much even worse if it wasn't for the efforts of the public health service in Spain. Above, we see the different types of transplants: the renal, hepatic, cardiac, pulmonary, and pancreatic, with different colors. Next. Here we can see the comparison between donation and transplantation. The top graph, we see the different types of donations: living donor in yellow and deceased donor in blue between 2019 and 2020. On the lower graph, the transplant activity between 2019 and 2020. As we can see in the blue line, the most dramatic drop was at the beginning of the pandemic between March and May, and has since recovered. After the first month of the pandemic, towards the summer, the hospitals were more organized and the activity of transplants almost returned to normal. We established more solid and continuous communication channels using technology to reach doctors, patients and relatives, and also between us, between the association, all the members. We had to modify our communications because we couldn't physically visit the hospitals. As association, we spoke directly with the main liver specialists to clarify the situation about the future of transplants. Next. And the waiting list at the end of December 2020, similar figures as last year, close to 5,000. In this aspect, has not improved between 2019 and 2020. In fact, this is the official waiting list. As we know, there are many more lists of patients due to their conditions and severity. Are kind of patients of parallel waiting list in the hospitals. And the hospitals always are very private with the information about the waiting list. In this sense, all the information we expect is all the information we received from our patients. We expect more delays or cancellations of medical visits, but in the end, we're not important delays. If the visits could not take place physically, it was held virtually, and the doctors were always available to answer our questions and the questions from the patients. We knew that the hospitals were in contact with the people on the waiting list along with us. Even some hospitals created a specific applications to keep patients informed. As of September, the index of donors and donations and transplants has been recovering, more or less. We have seen that the global figures have fallen in 2020. That doesn't mean that the cases or the patients have decreased. Many patients have not adhered to the waiting list because they were not diagnosed on time. Well, we know many people did not go to the hospitals because they were afraid about the situation. Well, the conclusions are similar. Our conclusions are similar to those comments by Mr. Marco and Professor Romero. It's more or less similar. At the end, better contact with the hospitals using telematic tools and apps and applications. Keep in touch over time with the patients. Hospitals have to offer different or new solutions over the time for the chronic patients, mechanisms for the patients to be more involved with the evolution of the disease and with the hospitals. The hospitals as well have to involve more with the patients' associations to help them, like us, for example, to be more cooperative and collaborative. Don't be afraid to go to the hospitals. And for the end, well, healthy habits to avoid liver diseases, of course, prevention, and ask for help for professionals and association before it's too late. Okay, next, thank you for attention.
Thank you, Joan. Thank you very much. It's important to share information about liver transplant during COVID and how we can manage this situation, because patients on the waiting list, they are waiting, they are anxious, waiting for the new liver. Thank you very much.
Thank you to you.